While the role of a psychologist is often confined to the therapy room, it actually involves many other tasks, such as conducting psychological assessments, research, constantly seeking supervision, and improving their skills to be able to deliver the best quality of care to clients. In this video, Dr. Annabelle provides a glimpse into the world of a clinical psychologist and how she goes about her daily life. This video is brought to you by Nectar.
Hi, I'm Annabelle, a clinical psychologist from Annabelle Psychology. I primarily work with the adolescents, adults, and older adult population. In my everyday work, I see a lot of people with significant relationship difficulties or having experienced trauma in their lives.
How does a day in the life of a psychologist look like?
I think generally people might have a misconception that we are very zen people. We wake up and then we do a bit of mindful practice at home, and then we do yoga and we're very calm. But actually, like any working mother and like most people out there, mornings are very, very rushed for me. So when I wake up, sometimes like leaping out of bed, I have to get my children ready for school, pack them up, send them to school. And I do a bit of a mindful drive to work. So mindful driving is really a time where I take a time for myself to center my attention and pay attention in the present moment. I find that really helps to just set my day right in that sense. So what that looks like is I might turn the radio off, I might really be very mindfully present when I get into the car seat, how my body feels on the car seat, how my hand feels on the steering wheel. When I'm checking my blind spots, it's like an intentional checking instead of just browsing and just looking. I find that is safer when I drive, and it really helps to set the tone right for me by the time that I get to clinics. Generally, I see maybe anywhere between 5 to 7 patients a day. They tend to be back to back. A large part of my work is therapy-related work instead of assessment. So I will, see the different presentations, and then we might have a bit of time for supervision that day, or at least once a week we will have time where I do supervision either for my colleagues or I seek my own supervision from my own supervisor. So as a psychologist, it's really important to make sure that you are talking to your peers or seniors about complex cases, thinking about what you might have done wrong or what you could have done better in session. For a psychologist, supervision is really important because it helps us get better at what we do. We are more mindful of what may have gone wrong in session, and to think about what we can do better. Sometimes that involves processing how we feel, because sometimes what the patient say to us might have an impact on us. Maybe it triggers a certain experience that we ourselves may have had. And then we want to be very mindful of that, because we don't want to allow our own experiences to interact and affect the patient, because that's not what therapy is about. Therapy is about the patient, not about us. Sometimes it's talking about skills, reflecting on what we could have done better or what we didn't do so well. That might require us to do a little bit of a literature search. So part of my week, we do have time to just catch up on readings, making sure that we are up to date with the newest therapies, or maybe not even just the newest, but just making sure that we are familiar with the therapies that we need to use in session. Then some admin-related work like reports, or sometimes clients require memos for insurance or for their employers or schools, things like that. Some admin-related tasks, and then the day is over. Go pick my children up, and then I spend the rest of the evening with them and try to get them to bed as soon as possible so that I can have a little bit of the evening to myself.
What is something you look forward to every day?
In the morning, I look forward to lunch, but actually I really genuinely look forward to therapy. I like doing therapy. I find that therapy is a very empowering process. A lot of times patients actually tell me that they learn a lot from me, but actually I think I learn a lot from them. So therapy is a collaborative approach. It should never really be a top-down where the psychologist is teaching you or telling you what to do or telling you that you should or should not do this or helping you make decisions. That's really not our role, but really our role is more to help you make wise mind decisions. So decisions that are not impulsive, decisions that you have thought about, you've considered the consequences, you've considered the different perspectives, you've taken a step back, assessed the situation. And through therapy, I get to know all the different people from different walks of life, people who have had experiences that, in my opinion, is really humbling. And I feel really privileged to be in this position that I can help them, fulfill what they want to fulfill in their life and to have better qualities of life as well.
Do your friends often approach you for advice?
I think psychology itself, while it requires hard technical skills to do what we do, I think the more important part, which is maybe the less teachable part of it, is the soft skills. Is the ability to kind of attune, the ability to empathize, the ability to make people feel comfortable. We are not taught that in uni, so there's no a module on how you do that. But that also means that it takes certain types of personality to be a psychologist. And I think these are the personalities that people tend to gravitate towards when they have difficulties in their life and they really want a listening ear. So I think that happens in my own life as well. I do find that, my friends or my family members, when they're struggling with something in their life, they might gravitate towards me a little bit more and want to share with me a bit more about that. I've come to accept that, I think that's really normal, and it's not necessarily the fact that I'm a psychologist, but it's more the fact that maybe they feel a bit more comfortable. So in my capacity as a non-psychologist, I will support them as a friend or as a family member by providing a listening ear or just reflecting some things that they've talked about. I try to consciously take away all the psychological strategies and technique and skills out of that, but to just create that safe space for them. I suppose it also helps that a lot of my other friends are also psychologists themselves. So I think that's okay. We have a common language in that sense. But also the other thing to take note is that psychologists, like the rest of us, we are all people as well. We are human beings. Even though we know the strategies, it does not exempt us from feeling pain. It doesn't exempt us from experiencing the different challenges in our lives. So psychologists ourselves can also get sad, can also get angry, can also experience the whole range of emotion, can also experience anxiety like I am now in front of a camera. So I think these are really, really normal experiences. When they get overwhelming and they start to interfere with their functioning or their way of life, then one thing that we also recommend is for psychologists to seek their own therapy. And sometimes it doesn't even mean that you need to have difficulties in your life before you seek a psychologist for therapy. Sometimes that session is used to get to know yourself a bit better, make sense of your own experiences and your own thought processes. So yes, psychologists do see psychologists. And in fact, if you want to pick a psychologist, I imagine that will be quite an important thing to consider, whether your psychologist herself seeks therapy herself and whether she seeks supervision for the work that she does.
What are some common questions that you have been asked as a psychologist?
So I think one of the commonly asked questions about the difference between a psychiatrist and a clinical psychologist is that a psychiatrist is a medically trained doctor. So he will be the one prescribing you with medications, looking after the dosage and the side effects from taking the medications. As clinical psychologists, we are not medically trained, so we do not prescribe medication. More commonly, in public, we might call it the talk therapy, but basically we will be examining thought patterns, because the way we think about things will affect the way we feel and the way we react. a lot of times the way we think about things is a result of our childhood experiences, how our family has parented us, the experiences that we've had in school or our previous experiences with romantic relationships. They will shape the way that we think about things today. So a psychologist will kind of dig deep, and I like to say we treat the root rot issues. So issues that are kind of deeply seated, and we kind of talk about those things, process them, make sense of that. We also talk about skills. So in a here and now mode, if you have difficulties getting out of bed, for example, if you feel really anxious that you cannot be in a social setting, for example, then we talk about skills, both behaviorally, small little things that, we can do in a graded way, and also to change the way that we are thinking about things. So another misconception that people might have about psychologists is that whether we can read your minds, and that's the favorite question whenever we enter a party, can you read my mind? Short of the fact that it's close to lunchtime or dinner time that I can probably read your mind that you are hungry and need food, we can't read your mind. At best, we can make hypotheses like guesses about what you may be thinking based on our interactions with you, based on your experiences, based on the way that you have been coping with the other difficulties in your life. We can make some guesses, but we can't get it right all the time. Like with everyone, when you make guesses, there'll be times that you get it wrong, and sometimes you get it right. So it's, I take it upon myself to check in with the client, actually does that fit with how you're feeling or what you're thinking? But other than that, no, we can't read your mind. And if any psychologists put themselves out to be able to read your mind, you want to be careful about that. Another question that comes up is that whether we get manipulated by patients, and how do we deal with that? I think maybe the first thing is to look at the definition of manipulation. The way I see it is that manipulation is really a coping strategy. This person would have at some point of his or her life may have had to learn that if I manipulate my way, then I can get some of my very core basic psychological or emotional needs met. But that's not really with the intention of manipulating. That's really just I'm trying to get my needs met. So an example that may be quite common is if I verbalize my needs, my family members all ignore me. But if I tell them that I'm sick, I have fever, or I'm hurting, then they would, look out for me and they will show me concern. But what I really want is the concern, right? But to the layperson's eye, you are manipulative. So I think we need to explore that concept a little bit. So I do that with my patients. We explore that because sometimes they come in and say that people give me feedback that I'm manipulative. And sometimes I think I'm manipulative. So we'll explore that a little bit, what that means for that person. Or sometimes when it's not ready to explore that, I do allow my patients to manipulate me as well, while being fully aware that that's happening, because that's suggestive to me that the patients don't feel safe yet. They haven't established a degree of trust with me. So this is the existing way that they know how to cope. And it makes them feel safe while figuring out whether I'm a safe person to talk to. So yes, if that happens, I would allow that in my session.
What do you find most rewarding about being a psychologist?
So success to me in my job is watching my patients make improvements. So a shift in the way that they think about things, when they can practice a bit more compassion and kindness for themselves, to be able to have functioning, better quality of lives. So that can include being able to sleep better, being able to go back to work, being able to maintain or initiate or maintain relationships. Those would be what I consider success in therapy, and that gives me meaning in what I do.
We hope this video has been useful to you. If you'd like to learn more about mental wellness, do check out our other videos.